Do you know that what are the symptoms of a heart attack, and how should someone respond immediately? Hello and welcome to Expert Living, your go-to channel for expert advice on health and wellness. Today, we're discussing one of the most important topics in the world of health, heart attacks. Heart disease is one of the leading causes of death worldwide, and understanding the symptoms of a heart attack could potentially save your life or the life of someone you love. In this comprehensive guide, we will break down the most common signs and symptoms of a heart attack and explain how to respond quickly and effectively if you or someone around you is experiencing one. Remember, in situations like this, every second counts. The quicker the response, the better the chances of survival. Let's get started. What exactly is a heart attack? Before diving into the symptoms and immediate responses, it's important to understand what a heart attack actually is. A heart attack, medically known as a myocardial infarction, occurs when the blood flow that brings oxygen to the heart muscle is severely reduced or completely cut off. This usually happens due to a blockage in one or more of the coronary arteries. The blockage is most commonly caused by the buildup of fatty deposits called plaques in the arteries, a condition known as coronary artery disease, CAD. Over time, plaques made of cholesterol and other cellular waste products accumulate inside the arteries, a process known as atherosclerosis. When a plaque ruptures or cracks, a blood clot forms around it, further narrowing or completely blocking the artery. When the heart doesn't receive enough oxygenated blood, its muscle tissue begins to die. The longer the heart muscle goes without oxygen, the greater the damage. Without prompt treatment, this can lead to permanent heart damage or even death. The silent nature of heart disease. One of the reasons heart attacks are so deadly is that many people don't realize they're at risk until it's too late. Heart disease often develops silently over years or even decades without any noticeable symptoms. Many individuals might not experience significant warning signs until a major cardiac event like a heart attack occurs. That's why it's critical to be aware of both your heart health and the warning signs of a heart attack. Regular checkups and heart screenings can identify risk factors early, allowing for preventive measures that can save lives. Recognizing the symptoms of a heart attack symptoms can vary from person to person, but there are a number of common signs to watch out for. It's essential to remember that some people may experience mild symptoms or even no symptoms at all. This is known as a silent heart attack. In other cases, the symptoms may come on suddenly and severely. Here are the most common symptoms of a heart attack, which everyone should be aware of. 1. Chest pain or discomfort. Chest pain or discomfort is the most well-known and common symptom of a heart attack. However, it's important to note that not all heart attacks cause the classic chest pain that we often see portrayed in movies or television. Chest pain during a heart attack typically feels like pressure, squeezing, fullness, or tightness in the chest. Some individuals describe it as a heavy weight or crushing sensation, while others may feel more of an uncomfortable pressure. The pain can last for several minutes or come and go. In some cases, the pain is localized to the center or left side of the chest, but it can also radiate to other parts of the body. For many people, this symptom is the first sign that something is wrong. But, as mentioned, not everyone experiences it. It's also crucial to know that chest pain caused by a heart attack isn't always a sharp stabbing pain. Instead, it's often a dull ache or discomfort that worsens with physical exertion and improves with rest. 2. Pain or discomfort in other parts of the body. While chest pain is the hallmark of a heart attack, it is not the only location where pain or discomfort may occur. Heart attack pain can radiate to various other parts of the body. The most common areas include the arms, especially the left arm, back, neck, jaw, or stomach. This can sometimes confuse people because they might attribute these symptoms to other conditions, such as a pulled muscle, indigestion, or even stress. In particular, women may experience more pain in the back, neck, or jaw rather than in the chest, which can make recognizing the heart attack more difficult. This discomfort can be subtle or severe and might come on suddenly or gradually build over time. 3. Shortness of breath. Another common symptom of a heart attack is shortness of breath, which often accompanies chest pain but can occur without it. Shortness of breath happens because the heart is not pumping blood efficiently, leading to a lack of oxygen throughout the body. This symptom can make the person feel like they are suffocating or unable to catch their breath, even when sitting still or resting. This breathlessness may be more pronounced when performing physical activities, but in the case of a heart attack, it can occur even at rest. For many people, the sensation of shortness of breath is one of the earliest signs that something is wrong, especially if they have not previously experienced breathing difficulties. If you or someone else suddenly finds it difficult to breathe for no apparent reason, it's crucial to seek medical help immediately. 4. Nausea, indigestion, heartburn, or stomach pain. Digestive symptoms, such as nausea, vomiting, indigestion, or a feeling of fullness, are common during a heart attack, especially in women. These symptoms can often be mistaken for less serious gastrointestinal issues like food poisoning or acid reflux. However, when these symptoms are combined with other signs of a heart attack, such as chest pain or shortness of breath, they should not be ignored. For some people, the pain or discomfort in the upper abdomen may feel like heartburn or a tight, bloated sensation. It's essential to consider the context of these symptoms. If they appear suddenly, without any clear cause, or are associated with other signs like fatigue or shortness of breath, they may indicate a heart attack. 5. Sweating and cold, clammy skin. Unexplained sweating, especially cold, clammy sweat, is another hallmark symptom of a heart attack. The body may suddenly begin sweating profusely, even when the person is at rest and not exerting themselves. This is often a result of the body's stress response to a heart attack, as it attempts to regulate its internal temperature and maintain normal blood flow. The skin may feel cold and moist to the touch, and some individuals might appear pale or flushed. This symptom can often be mistaken for other issues like anxiety or panic attacks, but when combined with other signs of a heart attack, it should be treated as a medical emergency. 6. Fatigue and unexplained weakness. Feeling unusually tired or experiencing a sudden onset of fatigue is a symptom that is often overlooked, particularly by women. Fatigue can occur days, weeks, or even months before a heart attack as the heart struggles to pump blood effectively. People who are having a heart attack may feel so weak and exhausted that they cannot perform simple daily activities, even if they've had plenty of rest. Unexplained fatigue should never be ignored, especially if it is combined with other heart attack symptoms. It is often a signal that the heart is not functioning properly, and immediate medical attention is required. 7. Dizziness or lightheadedness. Feeling dizzy, lightheaded, or faint can also be a symptom of a heart attack. This sensation is typically caused by a sudden drop in blood pressure, which results from the heart's inability to pump blood effectively. In severe cases, the individual may even lose consciousness. If you or someone else experiences sudden dizziness along with other symptoms of a heart attack, such as chest pain or shortness of breath, it's critical to seek emergency medical assistance right away. 8. Irregular or rapid heartbeat, palpitations. A heart attack can also cause arrhythmias, or irregular heartbeats, which may feel like the heart is racing, pounding, or fluttering. This sensation is known as palpitations and can occur as the heart struggles to maintain a regular rhythm in response to the reduced blood flow. While heart palpitations are not always a sign of a heart attack, they should not be ignored if they are accompanied by other symptoms like chest pain or shortness of breath. For individuals who have a history of heart disease, experiencing arrhythmias during a heart attack can significantly increase the risk of complications, including cardiac arrest. Immediate actions to take during a heart attack. Knowing what to do in the event of a heart attack is just as important as recognizing the symptoms. Acting quickly can save a life. Here are the essential steps to take if you or someone else is experiencing a heart attack. 1. Call emergency services immediately. The most critical action you can take in the event of a heart attack is to call emergency services immediately. Do not try to drive yourself to the hospital, as this could put you and others at risk. Instead, call an ambulance so that paramedics can begin life-saving treatment on the way to the hospital. Time is of the essence during a heart attack. Every minute that goes by without treatment increases the risk of permanent damage to the heart. If you're unsure whether someone is having a heart attack, it's better to err on the side of caution and call for help. 2. Keep the person calm and still. It's important to keep the person calm and prevent them from exerting themselves. Movement can put extra strain on the heart, worsening the situation. Have them sit or lie down in a comfortable position and encourage slow, deep breathing to help reduce anxiety. Thank you for watching this in-depth guide on heart attack symptoms and immediate response. Remember, Acting fast can save lives. If you or someone you know experiences any of the symptoms mentioned, don't hesitate. Call for help right away. Prevention is always better than cure, so make sure to take care of your heart every day. If you found this video helpful, give it a thumbs up, subscribe to Expert Living, and hit the notification bell to stay updated on more health tips and solutions for a better life. Stay safe, stay healthy, and we'll see you in the next video.